It's really my pleasure to introduce our two legislators this morning. Senator Richard Briggs was elected to the Senate in 2015 after serving on Knox County Commission for several years. He's the first vice chair of state and local, member of the Health and Welfare and Transportation and Safety. This year he was also named chairman of the Senate Ethics Committee, where we've had some issues the last few years. Representative Bill... Pardon?
Just one more thing about
all right.
What were you doing up at 3 o'clock?
Right. Surgery. Those of you...
Surgery till 2 o'clock.
Yeah, those of you that don't know, he is a heart surgeon. But we really appreciate your being here as well. Representative Dunn, Chairman of the House Calendar and Rules Committee, member of the House Education, Instruction and Programs Committee, and House Transportation. Served as a state rep since 1995, and most of the time doesn't have an opponent, which tells you something about the strength and what a good legislator he is. We also, as Alan said, thank you for filling in. Senator Massey, we were going to have two senators. She was sick, and we told her not to come. All right, let's get started. One of the governor's top priorities, as most of you know this year, is legislation that attacks the opioid epidemic on several fronts. After the legislation was filed, the Tennessee Medical Association announced its objections to several parts of the bill, saying that it would interfere with doctor-patient relationships. Well, Senator Briggs, does it?
I was going to pass that to Dr. Dunn here, but I guess I better answer that question. I have talked of course they came to my office just as soon as the governor made that announcement. I think what we have to focus on the governor's bill, and I want to say first of all, and I told the governor this, I don't always agree with the TMA, but I think that what our goals are with what the governor was talking about are identical. We're not trying to keep pain medication from people that are having surgery or have acute pain, or even those that are taking long-term pain medication. That's not the goal. The goal is to keep unused pain medication out of the medicine cabinet that's sitting there, that may sit there for years, that can be diverted to children or grandchildren, or who knows, could be a neighbor or someone else that comes by. That's the goal, so people get the amount of pain medication that they need and take, but those extra pills aren't sitting around. There's different ways, and yeah. And I know that Representative Dunn is carrying part of the governor's agenda on this, but I really think that we can get the TMA together, we can get patient advocates together, get the governor together, once we realize that the goals should be identical for everyone. It's just a matter of how to get there. We can do partial refills. CVS Pharmacy already is doing partial refills on pain medicine. Well, they'll, if you have a 10-day supply previously, they'll give you the 5 days, and then if you need more, you can come back and do it without having to go back to the doctor. But these are different ways that we can look at it, and it doesn't have to be an adversarial relationship with the governor and what we're going to do about it if we keep focused on what we're trying to do, which is to keep unused pain pills out of the cabinets.
Well, I guess one of the questions I would ask is that there's in the budget $30 million to address the issue. Is that enough? I mean, I keep hearing people talk of it, especially the opposition party, saying that is not enough money.
I think you could say about any amount of money, it's never enough, particularly when we're dealing with government. But 30 million is something. It's a start. It's not going to solve the whole problem, because we have probably, even in Tennessee, we've got tens of thousands of people out there that are addicted to drugs, and I do want to say that many of those people became dependent on the drugs not through any fault of their own. They weren't trying to get high. Back in the 1990s and the early 2000s, the doctors were taught, the government encouraged it. Matter of fact, the government would, even the federal government, the state government has some blame here, insurance companies have blame, that OxyContin was a non-addicting drug. that if you didn't give enough, no one should be having pain. Pain was the fifth vital sign. What's your pain on a scale of 1 to 10? The Joint Commission of Accreditation of Hospitals would come through and sanction hospitals if you weren't giving enough pain. They had patient surveys called Press Ganey, went to the doctors. One of the questions was, did your doctor give you all the pain medicine you want? If you said no, you were penalized. You got pay cuts from the federal government because you weren't dispensing enough pain medicine. And so we have a lot of people to blame, for this. But we have now people who are good people, and some of you here may be on long-term pain medicines. You did nothing wrong. You had a problem, you went to your doctor, a good doctor, he prescribed the medicine the way he was encouraged to prescribe it, but now the tolerances are high, and you know, you may feel that you need it, but we do have a big problem now on trying to get people off the pain medicine. We lost over 1,600 people last year due to accidental drug overdoses.
And we've had locally quite a few.
That's just in Tennessee. We lost somewhere between 40 and 60,000 nationally. I mean, that's more than was killed in 20 years of Vietnam.
Bill, the governor's bill looks at three things, as I understand. One's prevention, one is treatment, and then one's law enforcement. And you've been asked to carry that bill, is that true?
It's been divided into 2 parts, and I'm carrying one. Okay. Can I say something about how much the bill's going to cost? Yes. You mentioned that the $30 million. I think $25 million of that is for treatment. So that's where most of the money's going to go. But if we don't change anything on the front end on how many pills people get, then we're going to always need more than 30 million. What you would hope is that by stopping people getting addicted, suddenly the 25 million or 30 million will be enough to take care of those who, through no fault of their own, get it. But if we don't change the front end, the 5-day limit or something along those lines, it actually, I think the number's closer to 80 to 90 million is what we would need for treatment for the current population.
And how does that treatment, is it written in the bill? Where do you get the treatment? How does that work?
Well, it's for recovery service, expansion of staffing of peer recovery specialists, and supplying naltrexone in the state's recovery courts and through county jail. Part of treatment, this treatment is so expensive because for it to work, it has to be for a long period of time. And unfortunately, sometimes we feel like we're doing something by saying, well, we're going to have treatment for 3 days, and actually we wasted the money on it. Would you agree with that? And so to really get someone off and away from their addiction, it costs a lot of money because you have to do long-term treatment on it.
So what kind of a facility would you go to get treatment? If we're putting the 25 million into treatment, where do you go? Is that do we have those facilities in Tennessee?
You know, when we talk about people who are on the opiates, there's really 2 different types of people. And again, some of you may be out here, maybe on long-term opiates for some medical condition. And you know, you don't need to go to an inpatient facility. What ideally you would like to have happen is you could work with your physician and gradually come down to a lower dose that's safer, and maybe even get off it and be treated for some chronic pain condition with non-opioid medication. The other people are the people who are truly addicted. Many of them got started on it through recreational use, and I mean, these are the ones that could move on to heroin or even the more dangerous drugs. The United States government has a whole department of mental health and drug addiction, and they recommend that those people, these are your true addicts, not people with pain issues, that they need maybe a month or 6 weeks of inpatient treatment, not only to start the detoxification from the drug, but also to get away from the environment that may have led to it. And you can imagine how long a month or 6 weeks of treatment would be. And then they'll probably need maybe even, I mean, you'll hear people say all the time, I'm a recovering alcoholic, I'm a recovering addict, and they've been alcohol free for 20 years because once you have that, you're probably that for life. So you may need the support, the equivalent of Alcoholics Anonymous, or some sort of support group that goes on for a very long period of time, and that's what can be that's what can be expensive. So there's two parts to this. There's those that we're trying to get down on a lower, safer, or maybe even off opioids to treat their pain, and then the others who are the true addicts.
All right, thanks for that. We'll open it up for questions after we finish, and if you have questions about the opioids or any of that, we'll address them then. But let's move on to another topic. The governor's UT Focus Act will greatly reduce the size of the UT Board of Trustees, create new advisory boards for the UT campus, and remove the governor as the chair and a voting member. News story this past week reported that all the gubernatorial candidates except for Speaker Harwell wanted to sit on the board when they are elected governor. What are you hearing about that? I mean, do you think that's going to pass? I sat on the UT Board of Trustees for 12 years, and it is a large board, and there's some ex officio members, Commissioner of Agriculture, Commissioner of Education, and the THEC head, in addition to people appointed from various and sundry other places, but mostly two, I think, from each congressional district. So that's made it larger. What are you hearing about this? And again, I've talked to several of the gubernatorial candidates, and they do want to sit on there if they are elected. Bill.
Yeah. I almost said something, but Georgiana Vines is taking notes. So I will. The governor sat down with the Knox County delegation before and spoke to us. And I think any time when it comes to making a decision on legislation or whatever, you gather information, but you also take into account who is sharing that information with you. And now that I've served with Governor Haslam for 8 years, there's a real level of trust that when he says something, you can believe that he's thought it through and it's a good idea. I've just seen it in so many different cases, and Tennessee is doing great because of it. So, it didn't take long to paint the picture that when you have 20-something people on there, that the board can't work quite as efficiently. And I've worked on boards, I've worked with groups, and the more people you have, two things can happen. You've got too many people trying to do something so nothing happens, or everybody says, well, somebody else will do it, because you can spread out and then nobody does it. So I don't think there's a magic number, whether it's 11 or 13 or how they would do it. But part of his initiative, as I understand it, is you would have the board, but then at each campus you'd have an advisory committee. Mm-hmm. So you would still have a lot of people who are very focused, but this time they'd be focused just on UT Knoxville or UT Martin. And I think that's a great idea. While they wouldn't be able to vote, they would be able to talk and advocate for that particular campus. So while you're reducing the voting members, you're really going to increase those who have an interest in seeing each campus do well. In the discussions, they're talking about, well, what is the board going to look like? And you mentioned, 2 from each. Mm-hmm. This, and I really wish the legislature would let the governor pick who they want to be on it. And then if we're looking for a particular makeup, the legislature will confirm or deny. And so we can kind of take some of that into consideration. But I would hate for the governor to get to a point where there's an opening and it's like, okay, I've got to find somebody who will check these different boxes, when I know there's somebody from West Tennessee who would be awesome on the board, but I can't pick them because we need an East Tennessee person from it. So let the governor pick who they want. Let's not put limitations on it. And then we can take into account diversity and geography and that sort of thing as we go through the process.
So it sounds like you're supportive. As I
understand it, yes.
Rick?
Right. I was at the same meeting where Governor Haslam first floated that idea. I think it was the Friday before Christmas when I first heard about it anyway. And I think the opinion of the representatives that were there that day was pretty much that we needed a smaller board. Many of us, again, had sat on boards, and large boards just don't work as well, I think, as smaller boards. Some of you may remember we used to have a 19-member county commission. And I won't call it dysfunctional, but the county commission we have now that's down to 11 members, it really works a whole lot better. And I sat on both a 19-member and an 11-member county commission. it makes me a little nervous to say that I disagree with Bill Dunn because he's, I don't know if he's ever been wrong, and I'm not going to say he's wrong on this, but I think we do have to have some geographic diversity. If we have the large UT Medical Center in Memphis, we have UT Martin that's in the central part of the state, Middle Tennessee, and then we have UT Chattanooga and UT Knoxville that are right here. And I think to start on this, you're going to have geographic diversity. If it's an 11-member board, to have two from each one or one from each one, however you want to do it. But I just think there would be a big problem if you had everyone from Memphis, or you had 10 of 11 from Memphis and there was no representation in the rest of the state. The UT board, people want to be on that UT board, and I don't think you'll have a problem finding talented people in all the regions that can contribute to that board. Now, where the real fight or argument's going to be is how you fill those other spots. I mean, I've had calls from faculty members say we've got to have a faculty member on there. Are we going to do it with gender diversity? We're going to do it with racial diversity? Are we going to have, who's going to be represented? And that's something that I don't have the answer to, that's going to have to be sorted out. But I do believe we've got to have geographic diversity. That's the one that I feel we have to have.
It's going to be really interesting if it does pass, when picking who's on it now and who goes off. Will everybody go off and there's a new board appointed? Do we know? Is that the way it works?
Can I just say, Senator Briggs was up till 2 in the morning. His brain is not as sharp as it usually is. It's not as sharp as it usually is. But as I said, I'm not opposed to some kind of diversity, but I think that's the legislature will take that into consideration. Believe it, we're not going to say, well, we're going to put 10 people from West Tennessee on it and stuff. I would just hate that there's a perfect person for the board and the timing is right. Because, sometimes when you get someone who really can make an impact, who was the guy who was the CEO for Tyson's Food? He's a UT graduate and all. Anyways, he was CEO of Tyson Food, a UT graduate, has been very supportive. All of a sudden, a window of opportunity opened where he would sit on the board and really bring something, but it's like, sorry, you're from the wrong geography. I'd hate for that to happen, because before that seat opened up again, he may be on to something else. Donnie Smith was his name. Started out in a chicken house and moved up to CEO. America's a great country.
All right, Bill, while you have the mic, you've introduced a bill this year to freeze tuition for entering freshmen at all four-year state institutions. UT has, I know, opposed that in the past. Do you have hope that it might pass this year?
No.
Well,
that bill was brought to me by a senator, and sometimes it's good to sponsor a bill that you don't think is a good idea, because then it doesn't go anywhere. That's part of being around a while. You kind of learn what to do. When the senator brought me it, I pointed out all the problems with it, but they needed a House sponsor, and so I have it, and I don't anticipate it going anywhere. In fact, it was introduced last year.
Right, I remember that. So, well, I can imagine that UT would be opposed to that. You got to get tuition raises every year, right? That's what generally has happened over there.
Well, what would happen is you'd have uncertainty. If you lock in someone in their freshman year, right, this is your tuition, and UT sitting there saying, well, we don't know what's going to happen in 4 years, so we better jack it up the first year to make sure we cover our
right
costs. And I explained this to the senator, and like I said, I don't plan on it going anywhere.
All right, let's talk about local a little bit. The business community has had concerns about the Planning Commission's recent attempt to require sidewalks in all new developments, as well as Recode Knoxville is underway. Senator Briggs, you have a bill that would require the legislative branch to specifically approve MPC's subdivision regulations. Talk about that, what you're hearing, and tell me why that was introduced.
Right. What occurred is, and I had a conversation yesterday afternoon with Mr. Green, who's the executive director of the NPC here in town. Evidently a month or two ago, or maybe it was a little longer, the NPC voted to enforce sidewalk regulations where every subdivision, now this is my understanding, every subdivision in even out in the county would have to have sidewalks. And there's, I believe, 8 NPC members that are appointed by the county mayor and 7 by the city mayor. The city has had sidewalk ordinances that go back a long time, and they also work into their budget maintenance of sidewalks. There's a couple of problems that came up out in the county. Is that first of all, for developers, it's more expensive to build sidewalks, and as a former county commission, we've never built sidewalks with county funds. We've never maintained sidewalks, and we also don't put in streetlights with county funds unless there's some very extraordinary situation. When that regulation and the way the ordinances and laws are right now, that was the final determining body, was the NPC. And it was never able to be referred to a legislative or an elected body, which would be the county commission. I'm working on an ordinance right now where before they set these regulations that are set by a non-elective body, that could be appealed if someone disagreed to the elective body, which would be the county commission. And I believe that we would find support among the city commissioners, we would find support among the county commissioners, and that's really what we're looking at doing is letting the county appointed commissioners vote on items like that, but it ultimately could be referred to the elected Knox County Commission, which is the legislative body, to determine. I hope I got that all straight, because it's a little bit complicated when we're dealing with regulations and zonings.
Have you talked to any of the commissioners or councilmen about this, other than speaking?
I've talked to both county mayors, and I believe that they would agree with it. I had a long conversation yesterday with Mr. Green, and I've never met him. If he's in here, I hope I didn't say something wrong, because I've never met him in person. Don't know what he looks like, but he said, and he thought that was a good idea. But he's neutral,
right?
But he just gives me information. But he would understand that would be a good idea. And we are going to have a bill. It'll be a local bill that'll deal with that.
Okay. Anything you want to comment on that, Bill?
No, I would agree with that. And in government, you're always trying to find that sweet spot. How much is government supposed to do, and how much is the private sector supposed to do? And I think somebody overplayed their hand, and so now that they've really meddled too much, the legislature steps in and tries to push it back. And so I think that's what we're going to have to do, because basically you're starting to get into, you can understand where you'd have rules and regulations like how wide a road would be, so emergency vehicles can be in, and where the entrance would come out on a road, that there's not a blind hill, that kind of stuff, that would actually deal with public safety. But when you start getting into amenities, first are sidewalks. You start saying if you have so many houses, you have to have a community swimming pool or a community park, and you start overplaying it, and that's what's happened. And then somebody has to maintain it, so people need to dial it back just a little bit.
All right. Another issue of concern locally has been the loss of revenue to local governments because of the reduction and probably anticipated elimination of the hall tax. Senator Briggs, you and Representative Zachary have a bill that would reduce the Department of Revenue's administration fee that's imposed on local governments for the remittance of local sales tax for the next 3 years. What are you hearing about that? Is that going to pass?
What it is when Knox County, and some of you, probably most of you in some way, are business folks, and all of us spend money in Knox County, the sales tax is collected and sent to the Department of Revenue in Nashville. They charge, I believe it's a 1.13, it's 1.1 something. Basically, it's a handling fee where they take, they're taking their cut out of it. Then they send the money back to the counties minus that amount of money. And I think just in Knox County, it's several $1 million. I don't think that bill's going to go anywhere. We'll have to. What we're doing is Representative Zachary and I. We're looking at what it's doing for a lot of the communities. The trouble is, I think there's going to be about a $30 million fiscal note on it. And if you want to kill a bill real quick, put a fiscal note on it. And the state has, and to take up, from the state side of it, we're eliminating the hall tax, which is the income tax on unearned income. We've eliminated many of these other taxes. There's been talk of eliminating the $400 professional tax that people pay too. But at some point, we got to have money to run the government on. And when we take it out of one part, if we take $30 million out of here, where are we going to take that money to make up for it? But it does seem like it's an unjust, unreasonable fee. And the bill actually calls to phase this out over 3 years too. So it wouldn't be all at once, but it still is going to have a big fiscal note to it, and it does have a big fiscal note.
Bill?
I just think it's interesting that the price tag was $30 million and the governor's opiate bill is $30 million. So it's a perfect example of, do we give the $30 million to the cities and the counties and then they decide what to do, or is it a better investment to take care of the opioid problem, and hopefully that would relieve some fiscal pressure on the cities and counties. And so those are decisions we have to make.
What, anything you're sponsoring this year that you want to talk about? I'll ask both of you that. What's your major focus in legislation?
I passed a bill this week, and you'll be proud of Knox County because it came out of Mike Hammond's office. He works with the courts, and right now when someone gets into the court system and all, they get fines and they also get court costs. And so some people have trouble paying them off. Because they can't pay them off, they can't get a driver's license, they can't go back to work, and it's a downward spiral. And so Mike Hammond came up with a program, and we passed some legislation 2 years ago as a pilot program to allow him to work with the judges to let people work off their court costs through community service. And so Knox County is the pioneer in that, and so this week on the House floor, we passed a bill to make it statewide. And so it passed unanimously in the House. It was very bipartisan. A lot of Democrats came to me and said, hey, this is a great bill. And I said, I know, just be quiet about it. You'll scare the Republicans away. So, and I think Dr. Briggs is the sponsor there, and I told him, let me move it in the House, and then he'll take it up. And there's another bill that I have that's I think is very interesting and could have a huge impact. Is, Tennessee is leading the nation in education improvement. I mean, we're zooming past everybody. People are coming to us to say, what are you doing? And part of it is because we have evaluations, and we're able to evaluate teachers through both the knowledge that they add to students through the evaluations in the classroom, and so they're on a ranking scale, 1 to 5. And because of that, we kind of know which teachers are what you call effective or not effective. And we can trace it back, and there's some interesting charts about which teacher colleges are turning out the most effective students. So I'm working with THEC to come up with a program, so there's sort of rewards and punishment. The more effective teachers you turn out, the better for you monetarily, because the best way to get the attention of higher education is to tie some money to it. And so hopefully what would happen is these schools that are turning out very ineffective teachers, they say, whoa, we need to quit doing what we've been doing for decades and decades and see what these schools that are turning out the very effective teachers are doing. So it's got a lot of promise into really changing effective teachers coming out, which will help everybody. You can imagine Knox County, wouldn't they rather have a well-trained, effective teacher at the front end as opposed to taking them 5 years to get them up to speed to do things? And so THEC is working with me. I wasn't real positive when I started down this path, but actually good things are starting to happen.
The bill that I have this year that I think may have the most impact in the state is my organized crime retail theft bill. And this bill started when it was brought to us by the large retailers organizations. This is Walmart, Target, Lowe's, Home Depot, and they were having a terrible problem with shoplifting, and not just shoplifting. I get in trouble for saying this. It's not a 14-year-old girl stealing lipstick, because I always use that example. They say, well, why don't you ever talk about the boys? But but anyway, I'll apologize to anybody if I offended them. But it's where literally organized gangs come into a community, and they'll go to a place like Turkey Creek or West Town Mall, and over the course of a week or two will steal $300,000. I mean, these are professionals. They'll shoplift $300,000 of merchandise. They have their whole group that's specialized in that. They'll have a whole group that brings it back without a receipt with all the tags. The stores don't give them cash, but they'll give them the value in what they call a stored value card. We call it a gift card. It's not really a gift card, but it is a stored value card. It looks like a gift card, and it'll have the amount that they bought it for plus the sales tax that they never paid. They take those cards and go to a place like pawn shops or game stores or someone, and they'll sell them in bulk for a discount. If it's a $100 card, maybe they'll sell it for $60 to them, and then the pawn shops, I'm using pawn shops just because that's where most of it occurs, but not of it, will then sell it to a national exchange. And you can go on the internet and buy a Walmart card for $100 for maybe $90. And they sell them like that, and at each step there's a discount to it. And that's what we were trying to stop. We knew that there was about $200 million in Tennessee that was being shoplifted, and when this money eventually gets back into people's hands, the state was losing somewhere between $14 and $25 million in taxes. So this is pretty big. That's all we thought it was organized crime. When I presented the bill the first time last year, there was a sheriff's deputy from Knox County who was there for something else, and he comes up and he says, it's really interesting what you said. We had 19 overdose deaths in Knox County in March, and 16 of those sitting right next to him, we found these cards, and they'd gotten those cards within 24 hours. And I asked Chief Roush, I said, I put the bill on hold. We passed a little piece of it last year, but I put the bill on hold, and I asked Chief Roush, would you look at April, May, and June in the city of Knoxville? They had 19 overdoses where the person either died or they had to use the Narcan to resuscitate them. Of those, they had 83 of them within 48 hours had card transactions. And so we realized that this was what was funding the drug trade. As we looked into it more and we talked to the retailers, they said that Knoxville had the highest shoplifting crime rate per capita anywhere in the country. And anyway, we designed a bill. What we're doing is that we've designed a bill. These retailers. They have a lot of resources, and this is their I forget what they call it. It's not stop loss. It's just their people who deal with that put a lot of money into it. Where they've loss prevention, and we actually had their corporate people from their corporate headquarters come down to some of our meetings, and they've put a lot of money into developing software that they can provide free to all the law enforcement counties, where they can track they'll put the cards, they'll enter the data in with the driver's license, the names, the pictures, all of that. We're going to require the pawn shops to do the same thing, and if they see all of a sudden one person's turning in 50 cards, they can notify immediately the retailer who can turn those cards off. Also, we have a bill that would have enhanced penalties because this is organized crime to try to stop this. This idea has been picked up this past week. We had a call from the Attorney General in Ohio and the Attorney General in Oklahoma that they said this is really good legislation that we would like to look at. We've been working with Georgia and Florida and Kentucky on this same issue, where if we can have the same shared data, then, because we don't want people stealing stuff in Knoxville and then going to Georgia or Kentucky and turning it into these big stores. And we think that this can really put a dent into the financing. I mean, again, $200 million just in Tennessee will really stop a lot of the illicit drug trade. And I think that's one of my major bills this year.
Oh, that's huge. It's nice to be known as the worst shoplifting town in the country. Wow, I don't think anyone
this is really drawn. We could see this. Bill has talked about how a lot of the things that we're doing in Tennessee in education. There was an editorial a couple of years ago where in the New York Times where they said, why can't New York be like Tennessee? But the anchor lady for NBC News came to Nashville, and they were doing an investigative report on this. They'd picked this up and did an interview on a national show that they had on this. So I mean, I think we're doing a lot of good things in Tennessee.
Right. That's awesome. All right, we'll leave some time for questions. We've got about 10 minutes. So, all right, in the orange.
So I had a question.
Dunn?
Yeah.
Like Yitter?
Sorry, about your work with THEC and the Tennessee Code for Task Force programs and other initiatives. What does that look like in terms of when you're training the teachers? Is there any classes or any program for them to be able to recognize the signs of not just if a child's being bullied, if a child is engaging in bullying behavior? Is there any, how does that work?
Well, I think, and I've got several sisters who are teachers. I had a daughter who was a teacher, and I think the larger picture, not just the bullying, it's classroom management. I think that's what makes teachers effective. And a lot of times in teacher colleges and stuff, they may deal with sort of the history of education and this and that, but we want it to be more real world. And so hopefully what you'll find is that by having classroom management be able to control what's going on, bullying would be part of that. Because obviously if someone's being picked on, the person who's picking on them is not learning anything, and the child who's being tormented is not learning anything. So I think that falls under probably classroom management, that if you get that right, the teachers will be effective and the classroom will be effective.
44 teacher prep programs in Tennessee. That's a lot. And some programs like engineering cost a lot of money. You can do a teacher prep program without a lot. So they all get it. There's not a tremendous, unlike engineering, where you have to pass regular boards, you have to pass something that has 99% pass. So it's not that good. But the real deal is these 44 schools have to start to produce people. These people are paying tuition. They're often borrowing money to pay that tuition. They deserve to be trained in the vocation of their choice, walk into a classroom, and expect them to be able to get that. They have to walk in there ready to teach. And frankly, 44, there's a good number of them, a good number of them that are falling short. Representative Dunn, dead on, let us know what we can do.
Thank you. Yeah.
Hi, gentlemen. You were talking about the effects of opiates regarding long-term effects, and of course opiates are long-term. Have you given any thought to people that are on short-term pain medication, like in hospice? I can tell you from personal experience, where I've got family members who are in hospice, and obviously others belonging in hospice. These painkillers are left around the facility or around the house, even to be worse. And these cause other problems too. So have you gentlemen ever thought about that or looked into that regarding responsibility for not only the patient but for the hospice service?
I think by law right now that's supposed to be under lock and key. Because I know, if you go to the hospital, they any controlled substance has to be locked up. When the nurses change shift, they do pill counts, and then they have to sign off. And I don't think the laws are any different. I don't think the laws are any different there.
Well, there may be a law, but it's not being enforced.
Well, but that's where, the legislature, we don't have our legislative police force. I am really surprised that when they come, because these places are inspected, and that's where you'll see more in the hospitals when the Joint Commission comes by to do their Joint Commission surveys. Narcotics, inaccurate records of narcotics is one of the cardinal sins that you have to correct. They're going to come back. You can lose accreditation or hospital. You can lose Medicare reimbursement. So it's a very serious violation when that occurs.
Specifically brought up not so much for the hospitals and those, but people that have hospice at home. And these people have several weeks to live, and they're passes on, hospice will come in and try to take accountability for what happened to those drugs and whoops, you're not there. You don't know what happened.
So you're specifically referring to hospice at home?
Well, see, hospice at home, I mean, what this basically is, I mean, hospice is coming there and helping, but we have the same problem if we give, and this is really what the governor's plan's trying to address. We talked, I think that was the very first question today, about trying to keep unused pills out of the medicine cabinet, and this is what we call diversion, is when someone else gets them. It's not just hospice. I mean, we don't have people, every time you have a prescription, the police aren't going to come in and see where the pills are. But what we're trying to do is to keep those unused pills out. And I don't think we're going to, it's going to be tough to have legislation on that. Now again, if it's any licensed facility, they are surveyed. And if they're not under lock and key, they do counts every shift. They can lose their accreditation, they lose their funding, and usually they're put out of business pretty quick. Now the problem is you can't control what goes on in everyone's home. That's just a lot more difficult. All we can try to do is to be sure that people have the medication that they need, but not have unused medication sitting around where it can be diverted.
Yes.
Just three quick questions. As a precursor, my sister is drug addict in her life, and I included for marijuana, and she also likes to feel a lot. So I know it's something similar. So three questions. One is, have we thought about medical marijuana? And I know that's probably just people small, but there are lots of benefits to that versus the opioid. Second was the question for net neutrality. I would think as a new net neutrality law allow for ADT to increase a lot more investment, because I think that was a whole benefit to net neutrality. I'm really curious about that. And the third one is in your new thing with payment issues. I've been in payments for 10 years out of San Francisco. Have you thought about approaching e-com Wi-Fi, the big distributors of the retail card, making that change the security issues that we just that would not allow them to sell the $9,000 for the identity. And things that they're taking you online. So if you haven't, I would want to
Let me, on the net neutrality, we've not had witnesses on that, we've not had testimony, and generally at the committee hearings where most of the business is done, we'll fly in people from outside of state, or we may even have summer studies on this where we'll spend 2 or 3 full days on it. I really can't comment on net neutrality. About all I know is what I've read in the newspaper, and that may or may not be a good source. I will comment on the medical marijuana. We have a marijuana bill this year in the state that's going to be come up. It's going to go before the Justice Committee in the Senate sometime in the next week or two, I know. I'm opposed to medical marijuana for several reasons. First of all, marijuana, this will be the first substance, medication, substance, anything, where we're completely bypassing the federal system. We have a government agency, it's called the Food and Drug Administration, that when someone thinks they have something that could be of benefit, companies will submit their preliminary research to it. They'll get approval to do phase 1, phase 2, phase 3 studies. The Food and Drug Administration determines which conditions that it's effective for. They determine what the dosages are. They determine the best method of administration, whether it's an inhaler, a patch, a shot, a pill, a capsule. They determine what the interactions are with other medications. They determine if in elderly patients or people that have liver failure or they're on dialysis, what dose adjustments need to be made, and those are made available to physicians. Then, after the drug is released, there's a monitoring process goes on, and there's forms you can fill out, because I may observe a bad reaction either with a medication or something that a patient's having, and those get submitted to the FDA, and they can investigate those, and sometimes they pull drugs off the market. Marijuana is the first substance where the people that produce this are saying, We don't want to go through the $500 million. It's very expensive to go through that process, I'll grant you. And there's been some criticism about how long it takes to bring a new drug to market. So what they're doing, they're going to the state legislatures where you have no medical expertise. You have no one that knows how to analyze the quality of research studies, and they're saying we want them to determine all of these things that I just mentioned. And and you'll hear me say this about many, many substances or many, many things, the state legislature shouldn't be practicing medicine. And I think when we've ended up with disasters. In 2001, the Tennessee legislature passed a bill. It was called the Intractable Pain Act. That Intractable Pain Act said that if I had a patient that came to me and he wanted narcotics, he wanted OxyContin, and I said, I don't think you should have it, by law, I had to send him to a pill mill, by law, or I could lose my license. And that didn't work out too well. We repealed that law in 2015.
Bill,
What he said.
But what I'm hearing is that you're against the process, you're not against the effects.
Well, I don't know what the effects are. Other than what somebody says, yeah, it's the process. We have a process.
Is there a way to correct that process?
Well, the process has worked pretty well. I don't know how many thousands of medications we have that are available. There's probably 5 times that applications have been submitted where it turned out we shouldn't be using them. They don't all agree. The FDA doesn't get it right always, and they have to pull drugs off the market, but there is a process for it. And my opinion is that they want to bypass that process because it's very expensive.
Bill, last word. Any last words?
Thank you, everybody, for coming.
And I'll say that too.
I'll stick around and talk to anybody about some of these issues, but I know we're past the time.
All right. Back to Terry Turner. Thank you, guys.